Historically, when people talk about traditional medicine, the conversation often travels quickly to Asia. The world knows about traditional Chinese medicine and techniques like acupuncture, where tiny needles are used to stimulate specific points in the body to relieve pain, improve circulation, and restore balance. Over centuries, the indigenous knowledge developed in a respected medical system that today exists alongside modern hospitals. But far from the mountains of China, in the creeks and the riverine settlements of the Niger Delta, another form of indigenous healing quietly developed over generations. Among the Ijaw people, traditional medicine was never simply about herbs or spiritual rituals. It also involved something far more practical and physical, therapeutic body manipulation, commonly referred to as the Ijaw massage. For centuries, Ijaw healers have used the massage as a method of restoring the body, correcting internal imbalances, and easing pain. In many communities, this knowledge was passed down through families, especially among elderly women who served as birth attendants, caregivers, and custodians of healing practices. Unlike modern physiotherapy clinics with medicine and clinical settings, Ijaw massage relied primarily on the healer's hand, experience, and deep understanding of the human body. The philosophy behind Ijaw massage is simple. The body works best when its internal flow is not obstructed. When muscles tighten, joints shift out of alignment, or blood circulation is restricted. Illnesses can follow. Through deliberate pressure, stretching, and manipulation of muscles and joints, the healer works to restore balance within the body. One of the most common conditions traditionally treated with Ijaw massage is muscle and joint pain. Fishermen, canoe builders, and farmers in riverine communities often performed physically demanding work. Long hours of paddling, carrying fishing equipment, or bending over nets frequently led to severe back pain, shoulder strain, and joint stiffness. Traditional massage practitioners develop techniques that focus on loosening tight muscles and realigning stressed joints. Many locals still attest that these treatments bring relief faster than ordinary pain medication. Another area where Ijaw massage has long played an important role is post-childbirth recovery. After childbirth, women in many Ijaw communities undergo specialized massage sessions designed to help the body recover from the physical stress of pregnancy and delivery. The massage helps tighten abdominal muscles, improve blood circulation, and ease body pain associated with labor. In some communities, warm herbal oils are applied to the body before the massage to further stimulate healing. Traditional practitioners also use massage to address circulatory problems and body fatigue. By applying pressure along certain parts of the body, healers aim to stimulate blood flow and relax muscles that may be restricting movement or causing discomfort. Many patients report improved mobility, reduced swelling, and a sense of physical rejuvenation after treatment. Perhaps one of the most interesting parts of the Ijaw massage is its use in correcting joint displacement and minor skeletal misalignment. In riverine life, slips, falls, and minor injuries are common. Rather than seeking surgical solutions, traditional healers developed practical manual techniques to reposition joints and reduce swelling. These practices bear similarities to what modern medicines now describe as a manual therapy or physiotherapy, yet they existed in the Niger Delta long before formal medical trainings arrived in the region. There are also cases where Ijaw massage is believed to help with nerve-related discomfort. Healers sometimes identify specific points in the body where tensions accumulate and apply sustained pressure to release it. While these practices are not always documented in scientific literature, they mirror principles found in other global traditional medical systems that emphasize pressure points and energy pathways within the body. One area where traditional massage appears to have maintained a unique advantage is personalized diagnosis through touch. In many modern healthcare settings, diagnosis relies heavily on machines and laboratory tests. Traditional healers, however, often depend on tactical observation, feeling the tension of the muscles, warmth of the skin, or stiffness of the joint to determine the underlying problem. While this method may lack clinical measurement tools, it reflects a deep familiarity with the body developed through years of practice. Another strength of Ijaw massage lies in its accessibility. In many rural Niger Delta communities where hospitals may be far away or expensive, traditional massage offers a practical and affordable alternative for treating everyday physical ailments. This accessibility helps sustain the practice across generations. Despite its long history, Ijaw massage remains largely undocumented in formal medical research. Most of the knowledge still exists in oral traditions passed from one practitioner to another. As modern healthcare continues to evolve, some scholars argue that indigenous healing practices like this deserves closer scientific study. Just as acupuncture transitioned from local Chinese tradition to globally recognized therapy, there may be valuable insights hidden within African indigenous medical system. However, it is important to approach traditional medicine with balance. While many people testify to the benefits of Ijaw massage, it should not replace modern medical care for serious conditions. Instead, the future may lie on integration, where traditional knowledge is studied, refined, and combined with modern medical science. What makes Ijaw massage remarkable is not simply that it exists, but that it survived. For generations without laboratories, textbooks, or formal training institution, communities develop practical ways to treat pain, support recovery, and maintain physical health. In a world that increasingly values indigenous knowledge, the story of Ijaw massage is a reminder that innovation is not always born in laboratories. Sometimes it begins in small riverine communities, where healing hands and lived experiences shape knowledge that quietly stands the test of time. And that'll be all for this historical fact. Stay with us as we bring you more details about the Niger Delta and the world at large. I am Kelvin Anakubo from Daspolitan Prime TV.